How did this become something that you wanted to spend your time talking about?
Well, in the very beginning, it was because when my daughter Frankie was born 5 years ago, I started calling my brother-in-law, who's an infectious diseases researcher at Children's Hospital in Philadelphia. And I was, all my friends weren't vaccinating their children, and so as with all things to do with my daughter's health, I would defer to my brother-in-law. And he started kind of explaining what the controversy was about, and I decided to get involved because I was just concerned for our children's health. And it's really quite simple. I mean, in terms of branching out to the global cause, I just feel like it's just so bewildering and frustrating that we have the medicine, that it's only a question of just getting it to the children.
Right.
I think that's sort of how I feel about it.
Right.
So,
why do you think there needs to be any convincing? I mean, you say your friends weren't vaccinating their kids. I mean, how is this? How can this be? We have, as you say, we have the medicine, we're not using it. Why is this such a hard message to get across to people?
I don't know if I'm an expert about that. I don't know really all the reasons. I mean, I have some ideas, but you know, science isn't really sexy, I don't think. It's definitely very hard for people to take hold of the data and take hold of the science and let that impact their decisions somehow.
What do you think people should do? I mean, you're working on the Shot at Life campaign. How do you see raising awareness, funding? I mean, what do you think the big hurdles to getting those vaccines to people are?
Well, I feel like people need to understand that we're close. I think that's the really important thing to understand. You know, the other day I was thinking about how my mom has Parkinson's disease, and she's doing quite well, but there's no cure for Parkinson's.
Right.
And so I think once, you know, parents realize that, as I said, we have these medicines, we have the cure, it's just about delivering it to the right people. It becomes really kind of inspiring. Right. And the idea that, I mean, we're not that close to eradicating polio, but we're getting there, and you know, we have to shut that door. Right. You know, I think the image of a closing door is really powerful because, you know, it's just a little bit more of a push, and if we don't, it can just swing right back open. And people talk a lot about herd immunity, and you know, one unvaccinated child is you know, can be a danger to all of our children. And, obviously, that's incredibly true overseas and in the developing world. So.
Right. I mean, it is amazing to think that we're down to
3 countries.
Yeah, and 1,000 cases.
Yeah,
I mean,
yeah.
It's stunning.
Yes, it's stunning, and it's inspiring, and hopefully it will make people feel like we can do it. Right. I kind of like the idea that it's really simple, actually. And it doesn't cost a lot.
No, cheap.
Cheap.
Especially for polio. Although on the flip side, at the same time, we've got a whooping cough outbreak here in the Northwest.
Yes.
Pertussis.
Yes. And my younger daughter had whooping cough in between her second and third shots. So she was very, very sick for a while.
That must have been scary.
Yeah, it was really scary. It was even more scary for my best friend, whose son was 3 months old at the time. So he had to take medicine right away. And yeah, it would be great if I think people could feel more of a sense of community about this. And you know, it's not about your child, it's about your neighbor's children and the infant down the street who just got home from the hospital.